Welcome back for our third and final discussion on diuretic agents. With our nursing implications, we want to be sure that we've performed a thorough patient history and physical examination. That complete health history needs to include mental and physical information in terms of what medications have they taken, particularly if they're on medications like lithium or other things that we need to know about. Data on any recent surgeries, any trauma, any of those disorders that could contraindicate or necessitate very cautious use of these drugs. We're going to want to get a set of vital signs, baseline fluid volume status, intake and output, serum electrolyte values, blood and urine specimens if we need them. Weight is very important. And with those vital signs, we want to include postural blood pressures. In our medication history, we want to include consumption of alcohol and nicotine, the use of any herbal supplements, or any alternative therapies to see that we do not have drug allergies or possible interactions with these diuretics. With our patient education, we want to instruct our patients to take these medications in the morning as much as possible to avoid interference with sleep patterns because of the increase in urination. They need to see their healthcare provider regularly so that they can have serum electrolytes and potassium levels drawn during the therapy, unless otherwise directed by the healthcare provider, of course. And if they need to take the diuretic at night, they should take it at least 2 hours before bedtime to avoid nighttime diuresis. If they have diabetes, we want to make sure that they are monitoring their blood sugar levels very closely, particularly with the thiazide diuretics, because those drugs can actually elevate the glucose levels. They shouldn't take thiazide diuretics when they are pregnant or nursing. When they take the loop diuretics or thiazide diuretics, they want to be sure that they're increasing dietary sources of potassium-rich foods, like our dark leafy green vegetables, nuts, citrus fruits, bananas, and potatoes. If they are taking potassium supplements, they're usually not recommended if the potassium levels exceed 3. We want to teach the patient to monitor their proper nutritional and fluid volume status. They may want to be careful if they're taking potassium-sparing drugs that they avoid the foods that are high in potassium unless they're otherwise instructed. So foods high in potassium include bananas, oranges, dates, raisins, plums, fresh vegetables, potatoes, meat, fish, apricots, whole grain cereals, and legumes. Typically, the body is pretty good about filtering out that potassium, but again, if you've got a potassium-sparing drug, it could be a problem. One of the things to point out is that oranges are actually higher in potassium than bananas. Our geriatric patients often think bananas are higher. But the other really high level is if you have dried fruit, like a dried apricot. Those can be much higher in potassium. We want to encourage these patients to avoid caffeinated beverages when they're taking diuretics because remember, caffeine is a diuretic. And so when it's combined with the effects of these medications, you can have a resulting dehydration. With potassium supplements, because potassium supplements are irritating to the GI mucosa, they should be taken with food and they should not be crushed or in any way melted in the mouth. They can take antacids along with them, but they need to be sure that they're talking to their provider about that beforehand. Patients taking diuretics along with digitalis or digoxin should be taught to monitor for digitalis toxicity, and diabetic patients should be told to monitor their glucose levels and watch for elevation, because remember, it's just simply concentrating it down. We want to teach our patient to change positions slowly and to rise slowly after sitting or lying to prevent dizziness and possible fainting or falling related to orthostatic hypotension. Unfortunately, that's one of the things that happens frequently with our geriatric patients. We want to encourage the patient to keep a log of their daily weight and to return for any follow-up visits or lab work. Patients who've been ill with nausea, vomiting, or diarrhea should notify their provider because fluid loss can be dangerous for these patients, particularly in fact if they have other medications that can then become concentrated. Signs and symptoms of hypokalemia include muscle weakness, constipation, irregular pulse rate, and an overall feeling of lethargy. We want to instruct our patients to notify their provider or physician immediately if they experience any rapid heart rates or syncope. That reflects hypotension or fluid loss, as well as a weight gain of 2 or more pounds a day or 5 or more pounds in a week. Those should be reported immediately. In our nursing management, we want to also let them know that excessive consumption of licorice, now this is black licorice, not red. Black licorice can lead to an additive hypokalemia in patients taking thiazides. This is an anise seed, so sometimes you will see this also in certain recipes. So the licorice, we want to be careful with that. We want to teach our patient to monitor for adverse effects like metabolic alkalosis, drowsiness, lethargy, hypokalemia, tachycardia, hypotension, leg cramps, restlessness, decreased mental alertness, and monitoring particularly for hyperkalemia with those potassium-sparing diuretics. It's important that our patients be able to translate these like hyperkalemia and hypokalemia into actual physical symptoms. So that's your job as the nurse, to make sure that they know what the signs and symptoms are that they are to look for, because anytime we're moving the fluid, and we're doing that with diuretics, we're shifting all of the electrolytes. And remember, we can't move one of them without moving another one someplace else. So therapeutic effects that we would like to see, of course, are reduction in edema, reduction in fluid volume overload, and reduction in the bad effects of the heart failure. We want to see decreased hypertension and a return, if we're using it for intraocular surgery or glaucoma, a return to the normal intraocular pressures. Nursing management would also include some nursing diagnoses. So potential nursing diagnoses that you might consider for this patient could include things like fluid volume excess, urinary elimination impaired related to diuretic use, or maybe they have a risk for a fluid volume deficit. So let's not forget the nursing process as we go through pharmacology. Again, questions? Contact me. You know how to get a hold of me. See you soon.